Welcome to this presentation on psilocybin mushrooms. We are going to go through the history and the mechanism of action, as well as some of the contraindications, like who should not go on a mushroom trip. And I am your host, DaeEss, 1Drea, formerly known as Dr. Andrea Pennington. I'm still a doctor, but I don't go by Andrea anymore. I am 1Drea. So let's jump into this. First off, what we know about psilocybin mushrooms is that they have been used for thousands of years. If we look at the Mayan and Mazatec civilizations, we can see evidence, archaeological evidence, that psilocybin mushrooms have been used since 3000 BC, including all sorts of cave drawings and hieroglyphics, as well as little statues. So we always start off by talking about this beautiful woman, Maria Sabina, and principally because she is the reason that we Westerners know about psilocybin. Maybe someone else would have done it, but this lovely curandera from Mexico was the one that really opened up the doors for us Westerners. She was a curandera, which means a healer or a seer, in Oaxaca, Mexico. And Maria Sabina actually allowed a Westerner into a ceremony. They're called veladas. And his name was R. Gordon Wasson. So Gordon Wasson was a banker, and he was kind of a part-time amateur mycologist. He picked up the love of mushrooms when he was with his wife, who was a Russian woman who knew about mushrooms from her home country. And she was the one that stimulated his interest and curiosity. So when he heard that there were indigenous cultures in Mexico that were providing these rituals and ceremonies, he got curious. He went to Oaxaca and little by little convinced Maria Sabina that he was a good person, raised eyebrow. And she allowed him to sit in ceremony with the little teachers, as they call them. He actually wrote about his entire experience in 1957 in Life magazine. And this went on to create such a rush of people going to Mexico, trying to see if they could have these experiences as well. And then one of the things that Gordon Wasson did is he shared this with his friend, Albert Hofmann. Hofmann on the left is the Swiss chemist who first synthesized and tested LSD. He's the first person to ever go on a psychedelic trip with LSD. So you may remember that it was in the 40s that Hofmann created LSD. Well, because he had Sandoz Laboratory that allowed him to create chemicals and test them, R. Gordon Wasson brought him some of these Mexican shrooms, and he identified several compounds in the psilocybin mushrooms. And one of those compounds was psilocybin. And what the active ingredient that actually works in our brains is psilocin, but we'll get into that in just a minute. Unfortunately, this story does not end well for Maria Sabina. She died in poverty and utter disgrace. Her community was in outrage that it was due to her that all these Westerners came into Mexico, and her house was burned down, her son was murdered, and she literally died in poverty. So I'm telling you all of this because we need to have respect for indigenous cultures. And now that we're in this psychedelic renaissance, we need to be mindful. And what R. Gordon Wasson was involved in was 100% exploitation. And what we're seeing now is a lot of appropriation. And I don't want y'all to fall into that. Okay, so why do we even care about mushrooms? Like, dude, well, it's because of their magical effects. So I mentioned that Albert Hofmann in 1958 identified psilocybin as one of the active ingredients in those mushrooms. And it gets metabolized in our body. It gets turned into psilocin. And psilocin is the one that has all of these effects at the serotonin receptor, specifically the 5-HT2A subtype. And what's interesting is when you look at the similarity of the chemical structure between psilocin and serotonin. So serotonin is something we make on our own. Most of us think of it as sort of a happy or feel-good kind of chemical. Now, the effects are exciting, and that usually leads us to think, if this is so great, what's wrong with it? Well, what we've seen in the last 50 or so years is that there is no dependence or addiction that happens to psilocybin or psilocybin-containing mushrooms. There does not appear to be any evidence of an increase in mental disorders. There's a slight caveat that I'll get to in a couple of slides. And when we look at people who've used psilocybin for most of their life, so generally starting in their teenage years to their adult years, studies have shown that there is not an associated elevation in suicidal thinking, suicidal planning, or suicidal attempts. And so that's really important for us to know and about these effects. So if we start looking at what most people are interested in, and that includes the scientific community, we're talking about mystical experiences. Mystical experiences were also written about by the American psychologist William James without the use of substances, but also Walter Pahnke and William Richards when they were doing all the experiments in the 60s and 70s and beyond. So mystical experiences are generally described as unity. We feel the sense of oneness. There's also a noetic quality. And noesis, or the noetic quality, means this inherent knowing. It's like you actually see or experience truth. You know a certain truth. And that's what many people describe in their mystical experiences. There's also a sense of sacredness, that what we're touching in this psychedelic realm is something holy or sacred. And a lot of people will describe having a deep sense of a very high or positive mood. We also talk about the ineffability of psychedelic experiences. Ineffable just means it's too hard to put into words. It's hard to describe, and it's true. And then there's the sense of paradoxality. It's like you're looking at two things that seem like they would never go together in your mind or in the universe, and suddenly it seems to make sense. And in the mystical experience, there tends to be a transcendence of space and time. All right. So there are really 4 domains that we look at when we're looking at the effects of psilocybin mushrooms. The first domain is perception. Generally, we will have sort of our senses being elevated. We might have mental images. So literally with our eyes closed, we might see images. And indeed, when people are under functional MRIs while taking psychedelics, the parts of the brain that are encoded for vision, they're lighting up, even though the eyes are closed. There may be a sense of any one of our senses gets intensified. So under the influence of psychedelics, it could be a sense of taste, smell, touch, hearing. Any of those can just be intensified. Of course, we always talk about hallucinations, seeing things, feeling things, hearing things, or smelling things that are not necessarily present in the room to other observers. And then our senses are also distorted in terms of our sense of time. Many people will describe that everything is all happening all at once, like they can see their past, their present, and maybe even their future. And so we're seeing that time is no longer linear for some people under the influence of psychedelics. Now, there are also cognitive effects. These are effects of our thinking process, our language, and even creativity. A lot of people report using psychedelics, whether a microdose or a macrodose, helps in problem solving. Everyone on the planet, just about, I'm sure 98% of the people on the planet is familiar with PCR testing. Maybe you already knew this, but the guy that created the PCR test that we've all become familiar with thanks to COVID, he credits that discovery with having experienced LSD that allowed him to visually see things from a different perspective. A lot of people will say that they find meaning. It might be meaning in the music that they're hearing during their ceremony. Other people will report that they find meaning in nature. So our cognitive effects are something we all talk about. On the emotional side, feelings, a sense of playfulness, laughter. I can tell you that my first heroic dose with psilocybin mushrooms, I laughed hysterically for 2.5 hours. But you can also have an intensification of all feelings. In the words of Stanislav Grof, he called psychedelics non-specific amplifiers, meaning they will amplify whatever is going on in your psyche. So if you are super depressed or you're grieving, that might be intensified. So it's an intensification of all feelings. But also, some people who've been shut off from their feelings find that they have a broadened access to an overall range of feelings. Many people will say that they finally can access joy or a state of euphoria. In addition, people will regularly say that forgiveness, compassion, connectedness also comes. And yes, there is the silliness, the involuntary grinning and uncontrollable laughter. These are also to be expected with psychedelics. Another domain of the effects that we can see with psilocybin mushrooms, if the dose is high enough, is ego dissolution. Some people call it an ego death. And it really is this birth of unity consciousness, feeling like your separate sense of self kind of dissolves and one doesn't just go away. They actually become one with all that is. It can feel like dying as you're moving up to the point of ego dissolution. Some people will feel like their physical body or their emotional body is literally dying. And if you're able to surrender to that and welcome it, a lot of people will feel like this relief and release. You know, we say very regularly in psychedelics, whatever you resist is only going to get magnified. So even if you were, quote unquote, feeling like you were going to die, if you can give into it, you're going to find that it is a much better experience for you overall. Also, with ego dissolution, there's a connection to all things. For some people, people who are either very heady, very type A, very stuck in their head, the idea of letting go or losing your ego identity can be very, very scary. But if you look at the research studies where researchers are giving people questionnaire after questionnaire after questionnaire before they take the psilocybin and after. And on a number of these, people who rate high in having a mystical experience and even high in having a difficult trip, they tend to be the ones that have the greatest improvement in their symptoms if they were depressed or if they had anxiety and their fears about death, because somehow in getting into this unity consciousness, they realize that there's probably something after this life and they're less afraid of it. So I'm going to jump now to some of the psilocybin research, and I'm going to just give you the highlights. I can't go over every single study or you'd be bored and we wouldn't have time to talk. But I'm going to take you from about the year 2000 to the present in terms of the research studies. Actually, that's not true. So I mentioned in 1958, it was Albert Hofmann, the Swiss chemist, who synthesized psilocybin and psilocin. And they actually did travel to Mexico and gave the synthetic psilocin to Maria Sabina. And she said, after she got the proper dose, that it was just like the experience with the little teachers or magic mushrooms. In the 60s, there was something called the Harvard Psilocybin Project. So these two figures are Timothy Leary and Richard Alpert. Alpert, you may more commonly know as Ram Dass. They were together at Harvard, and when they got a hold of LSD, this is when things started to go wrong. They believed that everyone should experience it, and as this was around the time of the Vietnam War, they created this whole counterculture of, in the words of Timothy Leary, tune in, turn on, and drop out. And they believed that you should just drop acid and then realize there's no need for war and all of that. Around in the 60s as well, there was a research study called the Good Friday experiment with Dr. Penke. And they basically gave psilocybin to a group of individuals who didn't have any diagnoses like depression. And they found that they could stimulate the same sort of compassion as a good Samaritan would have, and mystical experiences. And unfortunately, though, after Richard Nixon found out that people were avoiding the draft and avoiding going to war, the United Nations and the United States created a Controlled Substance Act. In the United States, we call these psychedelics Schedule 1. In the UK, it's Class A. But that's when everything got shut down, at least for a good long while. It was in 2000 that researchers at Johns Hopkins received regulatory approval to resume psychedelic research. So in 2006, there was this big psychopharmacology paper where they found that people who had high mystical experience ratings rated their experience on psilocybin in the top 5 most meaningful things they've ever experienced. So these were adults. These were people who had children. So a lot of people, when you ask them, when you're an adult, like, what's the most meaningful thing in your life? It could be the birth of a child. It could be, so many things. And over 68% of the people in that experience rated their psilocybin experience as one of their top 5 most meaningful. In 2014, there was a magic mushroom paper that showed that longtime smokers were able to quit after a couple of doses. In 2016, researchers, particularly at Johns Hopkins, but there are many other places in the world, found that people who had cancer, who were facing death, if they received 1 or 2 doses, high doses of this synthetic psilocybin, they found that their anxiety and their fear about death decreased. And then we can move to 2018. Researchers advocated at the FDA for the reclassification of psilocybin. The FDA then awarded psilocybin as a breakthrough status. And breakthrough status means this is a treatment. TRD means treatment-resistant depression. When you look at psilocybin compared to regular antidepressants, it far outperforms as well as or outperforms standardized treatment. And so since nothing had been discovered for decades for treatment-resistant depression, the FDA in America gave it this breakthrough status, and that allowed more people to get into clinical trials. 2019, there was more research published around alcohol use disorder. So we don't really call alcoholism anymore. We say alcohol use disorder. And it was in 2019 that the FDA gave psilocybin the breakthrough status for MDD, which is major depressive disorder. And in the last couple of years, we've seen research papers looking at fMRIs of the brain while people are on psilocybin. And they've noted that there are particular parts of the brain, you've probably heard it, named as the default mode network. It tends to go offline. And the default mode network is actually not a distinct area. It's several areas in the brain that are considered to be tied to our sense of self. It's the ruminating part of our mind. And maybe you've seen this image. The guy on the left there is Robin Carhart Harris. He is the principal author and investigator on dozens of these studies that I'm telling you about. And it was this drawing that you see here that kind of shows that before psilocybin, the brain's just kind of doing what it does in a very predictable way. And once psilocybin is taken, all of these brain connections, parts of the brain that are usually not talking to each other, are suddenly talking to each other. And he just happens to be one of the most famous folks. He has left the Imperial College in London and moved to California, plucked away for research. And that's me and Dr. Jill Stocker when we met up with Robin and several other psychedelic superstars in Miami in November. All right, so let's talk about some of the safety considerations. We usually think about physical and psychological safety stuff. First and foremost, the people who are not good candidates are people with heart conditions. In particular, if you have uncontrolled hypertension, if you have angina, which is persistent chest pain that is heart related, if you happen to have atrial fibrillation, prolonged QTC syndrome or QT intervals, these would be contraindications to taking psilocybin. And of course, if you've had any history of having a stroke and any EKG or ECG abnormalities. There are some medication interactions. So serotonergic medications, antidepressants, antipsychotics. So we're talking about Lexapro, we're talking about Prozac. It's not that we absolutely have a lot of data saying that you shouldn't take these medications with psilocybin mushrooms, but what we are noticing is that if people are on SSRIs, they have a blunted effect when it comes to psilocybin mushrooms. There are some doctors who recommend just increasing the amount of magic mushrooms you take. But in the medical world, we're afraid because we don't know what's going to happen. We don't have any data. And most clinical trials don't want to accept people in who are on these medications. It's also not recommended if you're on, excuse me, MAO inhibitors or lithium for fear of having something like serotonin syndrome, which serotonin is something that we make naturally. But when it gets too high, it's temporary, thankfully, but it could cause muscle tension, it could cause diarrhea, could cause sweating, could even cause seizures. So if you're taking antidepressants, antipsychotics, bipolar meds, or MAO inhibitors, it is not recommended for you to take psilocybin mushrooms or to do so very cautiously with a healthcare provider. If we look at your personal or family medical history, particularly the mental health history, if you have personally a current or past history of schizophrenia, bipolar 1 or 2, or any psychotic disorder that was not substance induced or some medical condition induced, those are the things that would be recommended that you avoid psychedelics. A first or second degree relative with schizophrenia, a psychotic disorder, or bipolar 1 or 2. And basically the risks of creating more persisting psychotic symptoms. If you currently have delusions, hallucinations, if you are frequently beset by disorganized speech or behaviors, if you have mania, described as having an elevated or irritable mood more than once a week, grandiosity, losing sleep, racing thoughts, distractibility, agitation, or any other unsafe behavior. The thinking is that psychedelics might amplify that, and so you would want to avoid. So back to your personal mental health history. If you have any substance use disorders, if you have a risk of relapsing, it would not be advisable for you to engage in psychedelics. There are some exceptions. We are seeing that, I mentioned some of the studies for alcohol use disorder. There are other addictive and eating disorder research trials going on for ibogaine, for example. Psilocybin has been used with tobacco, but in terms of the reason that you may have a substance use problem relates to trauma. If you have a trauma history, you may find that going into a session, a lot of stuff is going to emerge. So if you don't already have a good therapeutic alliance and good coping skills that prevent you from going back on using drugs or substances, that would be one of those relative contraindications. Again, there's the risk of creating more psychotic symptoms if people have personality disorders. And certainly if there's been any self-harm or suicidal behaviors in the week prior to sitting in ceremony, it would not be advisable unless you were at some medically supervised place. Now, it is understood that you can go to an emergency department in the United States, and ketamine can be used in the ER to help cut suicidality. So this is one of the things about IV or intramuscular ketamine that is really remarkable. And it's that it can decrease suicidal thinking within, one dose. And that can usually buy people time to get the resources they need. It's not meant to be an ongoing treatment, although some people will do a series of ketamine infusions and then partner that with therapy. All right, so the last bit of the risks that we'll cover. HPPD is something that a lot of people talk about, but very few people have seen. It has happened. This is hallucinogen persisting perception disorder. And that's where someone has this ongoing visual or perceptual problems and the distress that comes along with it. The incidence is low, mainly because in anything that we're seeing in research, they're screening out people and they have very controlled settings. But it's estimated that 4 to 5% of recreational users may experience HPPD. And despite what we were all told growing up, at least in America, that, oh no, don't take this stuff, it stays in your brainstem and you could have flashbacks. That's actually not true. Flashbacks are not commonly seen in research. So that is the end of my presentation. If you would like to have a private session to prepare for a retreat or to integrate your experiences, I am offering PRISM sessions, and I'll share the link in just a moment if you'd like to take advantage of that. All right, so let's open it up to your questions. Sure, well, I can give you some general insights. I can't specifically say what you should try, but I will start off with combo, even though tonight's about psilocybin. Combo, people call it the frog medicine. It's the green tree frog, and people are able to ethically and safely get some of the secretions off of the frog, and then they put it on your skin after burning your skin. And combo does not create psychedelic effects. So there is a whole lot of purging, vomiting, puking, shitting, sweating, yawning. Some people cry, but it's more of a purgative. It is meant to just clean the body and the senses. And a lot of people, because it is a very difficult or challenging experience, they come out with a sense of feeling empowered, but not so much of the deep psychological work that you might experience with psilocybin mushrooms, ayahuasca, or even DMT or ketamine. So with ketamine, generally all of these medicines, these allies, are really best encountered either in a safe community or group setting, like the indigenous have done for thousands of years, or with a therapist. Now, of course, a lot of people are advocating for just, decriminalizing, grow your own, take it at home. And that works for some people. Because I treat trauma and I have been working with people with substance and addiction issues, I don't recommend that, because I have seen what gets unearthed, even in my own life, in my own traumas, what got unearthed through ayahuasca and psilocybin. I find that you need to be plugged in to a therapeutic container on a regular basis. And so with ketamine, some people can experience, whether it's oral, intramuscular, or IV ketamine, and then follow that with psychedelic assisted therapy. Some people have found that when they go to just the regular therapist, sometimes the therapist has a negative view of psilocybin or ketamine or any of these, and that can impede your progress. So ideally, you'd want to have a support person, a therapist, a coach who is psychedelically informed and at least neutral, if not, in favor of these. Because going through it, you're going to want to reprocess parts of your life. So for many of us, that happens in the session. Now, with ketamine, you're only going to be out for an hour, hour and a half, at the most, depending on your which clinic you go to. So it can be really short and really fast. But it's going to give you just only a couple of insights because it's such a short session. But then if you follow that with your therapy, you're going to get insights about yourself, about the parts of you and why you do certain things, why you have certain fears. I find that with psilocybin, your average journey is going to be 4 to 6 hours if you're taking 2 or more grams. So you have a much longer period of time to work with your psychic content. And because it's got a slope, I mean, so you may start off super silly, or you may start off super anxious, but then once you finally get to a certain blood level, things might really shift for you. A lot of people are now looking at IFS, that's internal family systems. It's a type of therapy where we start to get to know our parts. So if you join me on Tuesday, the second Tuesday of the month, I lead a free guided meditation that's parts informed, where you get to know your inner procrastinator, your inner rebel, your inner child, and understand what happened to them and what beliefs they're holding, which is why they do what they do, these various behaviors, whether it's drinking alcohol or binging or relationship hopping or what have you. And so I for those reasons, because most of us are very complex, I find that the longer journeys with psilocybin or with ayahuasca, you're going to get more of a chance to really go deep into your psyche and work with them. Now, again, you've seen the slides, you understand that there are things that are contraindications. And so for most good practitioners who do good screening would want to make sure that you don't have those issues. It doesn't mean that you absolutely cannot. If you get your blood pressure under control, if you work with your psychiatrist to wean off the SSRIs, you can absolutely, if you don't have any of the other contraindications, you can sit in ceremony with psilocybin. It's really important for you to make sure that you find someone who you feel comfortable with, who's not just going to throw everything at you and say, okay, we're going to just do it all. I find that those experiences for many people are a little bit irresponsible and can lead people into having a really bad trip when they don't need to have a bad trip. All right, well, first of all, there are over 100 types of fungi that produce psilocybin. Now, we don't necessarily have them all growing in our backyards, so there generally are a handful of psilocybe strains. So you mentioned white albino or penis envy, there's golden teacher, there's enigma, there's so many different ones. So let's just start off with the big thing. All right, so a macro dose, that is what we would call a dose that you would actually feel perceptual effects. And that's anywhere from 1 grams, usually starting at 2 grams and up. But 1 gram, you'll see things. You may not see a lot of weirdness, but you'll have some effects. So if we think that a decent-ish dose starts at around 2 grams, a microdose would be 0.2 grams. So what you heard on the internet, the 200 milligram range, that is generally what most people say. Now, yes, you're right. It depends on your sensitivity, and it also depends on the strain. So I've had experiences where I've taken, when I first started my microdosing journey, I actually started with truffles. And truffles are precursors to mushrooms. Over here in Europe, we are legally able to buy truffles from Holland. And truffles just grow underground. As soon as they get above ground, then they're called mushrooms. You know, the fruiting body is a mushroom. And based on the law in Holland, in the Netherlands, they're not allowed to sell anything that grows above ground. Above ground is where, with the UV light, this psilocybin content is much higher. But underground, you still get psilocybin content. It's just a little bit lower, so you have to take more. But even with me taking, 200 milligrams, I felt the effects. Now, I didn't see anything. There was no hallucinations, but I realized that it was too high for me on a day-to-day basis to stay focused and to be able to drive and be coherent. So typically, I'm sure you've already seen this on the internet, there are kind of 2 schools of thought. There is the Paul Stamets stack, And there is the James Fataman protocol. And basically, what you're going to do is for 30 days, they recommend you start with one protocol or the other. So one protocol might be you take 200 milligrams. And again, it depends on where you're getting this, which strain it is, all of that. But ideally, you'd have a little scale and measure it and take it on a day when you don't have to work. You don't have to, do anything that requires fine dexterity. You might get one that makes you totally sleepy. You might get one that makes you laugh uncontrollably. You might not want to do that around your office mates. So I would say, trying it on a day where if you needed to be in bed, no problem. If you wanted to laugh hysterically, no problem. If you ended up crying all day, no problem. So that would be my recommendation there. And then keep a journal. Keep a journal of how much you took, what strain it was, and when you took it, and what the effects were, and when they came on, and when they wore off. And then typically you're going to not take it on day 2. Most people will still see that there's an effect, whether it's the concentration or the clarity. One of the main things I learned from my microdosing, my first year of microdosing journey, was equanimity. I had this even-keeled sense of things that would normally piss me off. I'd notice them, but I wouldn't get pissed off. Like I didn't have the same edginess. So you make sure that you're noticing your everyday life, your sleep, your energy, your mood, all of these things. So you can do it one day on, one day off, or one day on, 2 days off, or 2 days on. Fataman's protocol was more like doing it for 4 or 5 days in a row, and then taking 2 days off. And it's not that you're supposed to stay on that for life. You only do that for a month and then see what fits for you. When you look at the big microdosing study that they did, it was citizen science. They allowed people to go onto a website or an app and share their experience. They found that most people, after 30 days, or even after a couple of weeks, didn't do it like 4 days on, 2 days off. They started to learn their own body and their own brain. And they noticed, okay, maybe I only need it twice in a week. Maybe I need it 2 days before a big exam, not the day of the exam, right? So it's like once you start to know what effects it has on you, then you create your own regimen. And you always take some time off. So after a couple of months, you might take 4 weeks where you're not microdosing at all, just to give yourself a washout period. But you're going to be your best guinea pig and researcher. Golden teachers are, I know where you live there, you can get your hands on golden teachers in that area. And they are very gentle, I'd say. They're not hardcore. And so they are good for sort of opening up perception and doing whatever work on yourself that you need to do. So golden teachers would be fine. A lot of people say that the penis envy is really, really strong. I haven't personally experienced them as strong, but maybe I don't know. Maybe I'm used to my little European strains. I don't know. But yeah, do it and report back. Yeah, it is. It does put us in a bit of a conundrum, because if we look at the mental health crises around the world is not getting happier and healthier. Like the level of suicidality, depression, and anxiety continues to rise around the world. And these sacred medicines are actually proving to be incredibly effective. Just no wonder why people are traveling to have these experiences. I do think that having more people trained and being able to facilitate, even in North America, so that they're not putting the strain on South American resources, is helpful. There are ayahuasca churches, not necessarily tied to any religion, but just in North America, in the United States, you can get a designation as a FBO, a faith-based organization. We would typically call that a church, but they don't have to be a church. There doesn't have to be any Bibles or religion. And so there are those possibilities, but then you also need to look at who's facilitating. Because when you start stepping away from the indigenous culture, everybody wants to add their own flavor. And unfortunately, I find that brings in dangerous things. I feel like the closer you are to a tradition where your medicine team, your medicine man or woman has actually been trained and not just did some few months apprenticeship, but has been trained in a lineage, I think it's much safer. So I would say there are opportunities to fly to South America and work with indigenous people and going on a dieta, which means it's not going to be pretty. It's not like, oh, stay at this resort and we'll serve you the medicine. It's like without doing the appropriation or damaging. When you work with an indigenous group, they are safeguarding. They're not putting it into some resort facility. So I would say that those are still opportunities. And I think ask the medicine if you're able to go and sit in ceremony and you feel called to whatever part of it, whether it's advocacy or protection. Look at what maybe you've already seen what Chacruna is doing around their Indigenous Reciprocity Initiative, the ERI. I hope that helps a little. I would definitely stop microdosing a couple of weeks before you're about to sit with a heroic dose. Only because you just want to give your receptors the time to get completely washed out and be super ready to take that heroic dose and make the most of it. There's nothing worse than getting there and then like just having kind of a experience, so ease back before your heroic dose. There was a question about contraindications. So just to remind you of some of these, the mental health history is generally the biggest thing that we worry about. I don't know if you can still see that because I have this little box on the screen, but if you or a person has a current or past history of schizophrenia, bipolar 1 or 2, or some sort of a psychotic disorder that was not induced by a medication or a condition, they should not be certainly taking a macro dose. Same thing with the first or second degree relative. And the fear there is that there's this risk of precipitating persistent psychotic symptoms, delusions, hallucinations, and mania. So if you happen to be someone who had bipolar with maybe the depression side of bipolar, microdosing with psilocybin might be helpful in just upping the mood. I've seen studies, including out of Copenhagen University, that people did study psilocybin in people with bipolar without it causing mania, but they weren't doing microdosing. So we don't have enough data, and that's the problem. Nobody's willing to do the data. Like no research institution is willing to give people with bipolar 2, 1 or 2 doses. And the problem with doing a microdosing study is because your institutional review board at your highfalutin university is going to say, okay, I see you have this paper, you want to bring in 100 people and split them into 2 groups where 50 take a placebo and 50 get an active drug. And we're going to see what happens to them in that 8-hour session. And then we'll follow them up at 3, 6, 12 months. The thing with microdosing is you take the medicine and you go away. And no IRB wants to give someone some medicine that they're going to go home with, and we don't get to see what happens to them. That's why a lot of people are realizing that getting a microdosing study approved is going to be next to impossible. So I would say that if someone happens to have bipolar, if they are on the depressed side, it might be fine to try a microdose, and I wouldn't go on it for several weeks. But if they had manic episodes, I would certainly advise to not try microdosing psilocybin, and certainly not if they're not being followed by a professional who can advise and who could support, because what if it tips them off into mania and they have no one else to ground them? So there's always an easy way to do this by process of elimination. So we'll do it that way first. So if we think about MDMA, if I were counseling someone who had lost an adult son, yes, MDMA would be a nice choice if you can get it legally and safely. Because if you're buying just random stuff on the street and it may be laced with stuff like, oh my God, you would not want your aunt and uncle. No, absolute no. Now there are some psychologists who have access to MDMA because they've been given a certain status. And so you know that you're getting real deal, pure MDMA. That would be the only way I would ever recommend it. But you're right, that would be a very gentle, heart opening. It's not going to be necessarily mystical, but a lot of people will find benefit from MDMA. As for psilocybin, for someone with bereavement, absolutely. I personally had a heroic dose of psilocybin mushrooms as my mother was leaving this plane and after she transitioned, and found it really, really helpful. Now, if you look at the data, right, so there's lots of studies that have shown that whether it's end-of-life anxiety or existential dread or major depressive disorder, any of those, they're all being done in a very safe container. You might even think of it as kind of boring or sterile, but there's usually two practitioners. In most cases, they've been a male and a female. The person's lying on a bed. They've got eye shades. They've got headphones for music. And they're doing at least 3 preparatory sessions before the dosing session so that they feel comfortable with their guides, with the center, with the medicine, and what's going to come up. And they might even do a dry run, just like, okay, we're going to pretend this is your dosing day and this is what you would go through. Then they get to the dosing day and it goes as it goes. When you look at those kinds of studies, people find incredible benefit with getting rid of fear and anxiety and that bereavement. So if you had the right set and setting and dosage and support, like that whole matrix, then it could be a beautiful experience for them. But it needs to be well facilitated.